Okay, hello friends. How is everyone doing? How was the exam today? See, after the exam, I got a frantic call from a student. Student was saying there were only 3 questions of PSM. I asked him to relax, take time. And now I'm having 28, 29, 30 questions of PSM with me right now. So if you are ready, shall we start discussing? So we are looking at PSM FMG January 2026 recall. Okay, so let us start. We have in our session Dr. Ivermectin never ending also is there. Okay, friends, this was one question which we were having. Which statistical test is most appropriate for comparing cholesterol levels within a single group? So just go back to what we had discussed in the mission classes or even in the marathon rapid division classes also. When you are comparing cholesterol level in a single group, then that means we are taking two values before, after. Before, after means which test we are going to apply. Please confirm if the choices were correct. Yes, it is paired student t-test. Friends, I have prepared all these questions in last 1 hour only. So anywhere you find PSM was not there, ज्यादा नहीं था. 30 questions are there with me, तो 30 तो discuss कर लेते हैं, Dr. Yuhan. So paired student t-test before after. Please don't worry about the things which were not there. Check out of these 30 whether you managed to attempt 25 correctly or not, because majority of students are saying they were able to attempt 25 out of these correctly. So let's look at this. So this is within a single group. Okay. Any number of people may be there. Comparing cholesterol level in 300 patients, you are saying. If it was two different groups, then it will be unpaired. So you have to confirm me whether it was comparing cholesterol level in a single group. Original students have confirmed it is paired student t-test if it was a single. I'll come to everything, Dr. Sakurao. I have this question of Pearl index calculation also. Right? Okay. Number of patients don't make a difference if it is a single group before, after. Parametric, normal distribution, quantitative data we have discussed. Paired student t-test. Same question has been asked earlier in your exam as mean systolic blood pressure before, after an intervention. Right? Yes, Dr. Ritika Shukla is absolutely right. Question 2. Was this a question which plastic bag is not contaminated with blood? If these were the four options, then black. Why? Because black is for municipal waste. Municipal waste. It is for non-infectious waste. So municipal non-infectious waste. So kindly confirm if black bag you have marked as the answer. There were 4 questions from biomedical waste management. We'll come to them one by one. Please confirm, friends. Which plastic bag not contaminated with blood? That questions will come later. Just confirm if this question was there or not. Or was there image given in the choices, or yellow, blue, red, black was written in the choices? TPN bag is a separate question. There was another question we will discuss on expired medications also separately. Yellow bag incineration was a separate question. Right? Okay, this I will then relieve from the list. I'll reduce from the list. If you're saying I'm looking at the YouTube right now, you are saying TPN bag with tubes intact. We'll come to that question. Okay, look at this question. Rural program has increased number of vaccination, increased hospital delivery, increased access to healthcare. But when you compare it with urban areas, it was really less. Which of the following pillars? Which of the following pillars of primary healthcare is most likely to be exploited? Exploited. Can you answer this question? What you have marked in the exam, friends? We are looking at rural area doing very good. But when we compare with urban areas, it is still very less. This is a type of. The services should be equally distributed across geography, across socioeconomic status also. So look at this question, friends. 2-year-old child, bluish white spot. So we are looking at coplic spot opposite second molar tooth. Second was not mentioned. Students were telling me he has a history of cough and fever. Cough, fever, and even that is not required. Once they mention, once they mention coplic spot, I think 100% of you must have marked this answer correct. Yes, it is not on tooth. When they say in front of, this they are talking of buccal mucosa only. So you ask the child to open the oral cavity. If you can see in front of molar tooth, second on the buccal mucosa. Can you please confirm the other choices? Can you confirm the other choices, friends? Even if molar tooth is not mentioned, only buccal mucosa is mentioned. Even then, bluish white spot, cough fever, we are talking of measles. Okay, choices were fine. Mumps, rubella, measles, and chickenpox, as the students have reported. Okay, tooth was not given. I have excluded from the language. Please help me correct the questions. Help me correct the choices also. But I am sure this question, 100% of you must have marked correctly. Okay, can we move forward to the next question, friends, immediately? Okay. Yes, questions may be a bit lengthy because students, when they tell us in a single sentence. So whatever information we could get, by tomorrow, I will get almost all language. Cough and red eyes. Yes, that is correct. Congestion of eyes is characteristic. Also, retroauricular origin of rash. If they mentioned the rash started behind the ear pinna, that is also very confirmatory of measles, right? Okay. Look at this question. Anemic woman, second trimester of pregnancy. They mentioned receiving iron folic acid under Anemia Mukt Bharat. What should be added to regimen to improve the efficacy of therapy? If you look at this, they are saying efficacy of therapy, older FMG question repeated again. Vitamin C helps in improvement of absorption of iron in the diet. Only 10% only facilitator. Everything else is a inhibitor. Then there was a question. Patient of Northeast India, fever and chills, peripheral blood smear shows Plasmodium falciparum. So when they are saying Northeast, some students mentioned state Meghalaya was mentioned. So any state of Northeast or Northeast was mentioned. And we are looking at Plasmodium falciparum. We cannot give ACT-SP. We will have to give artemether lumefantrine with primaquine, right? Primaquine. So artemether lumefantrine primaquine. I'm sure dosages must not have been asked because in your exam, generally for anti-malarial drugs, they usually go for the name of the drug. Okay, Manipur was mentioned, not Meghalaya. Okay. So any northeastern state, answer remains same. Answer remains same. Right, great. Okay, adding sodium to butter is fortification. Dr. Abhishek, I was not having that question. If you are adding sodium to butter, but you will have to give me other choices. You only gave me fortification. That looks right. Primaquine is for 14 days. Yes. Primaquine is for 14 days. That is correct. Primaquine is for 14 days. 14 days. Yes. Was this the pond image they were asking? Pond image. A similar or this pond image was asked. If they're showing you like this, look carefully. This is a type of step well. They must have shown a better image. Students were not able to describe the image correctly. So if they are showing a step well in which people can climb down, then we are looking at guinea worm. We are looking at guinea worm. Guinea worm. Vitamin A2 butter is food fortification, Dr. Priya. If you are saying it was not sodium, vitamin A, that is food fortification. So vitamin A and D is added to dalda oil also, butter also, that is fortification of food. This is guinea worm. People walk, then it can enter cyclops body. People are consuming. See, when people consume infected water containing cyclops which are infected, reaches, a person walks through the step well, water comes contact, skin of the leg ruptures, and suddenly the cycle is completed. Doesn't matter if there were pots near the step well also. Pots near the step well also, right? Okay. So this is Guinea. Okay, this was an image given. Rule of halves. Every time it comes in your paper, if you remember in one of your GTs also, we kept a similar question. What was mentioned was that prevalence of the disease was not 50%. I think it was 30%. Is it? If the prevalence of the disease was 30% who are having hypertension, then out of them, 15% will develop symptoms, half of them. So if prevalence was 30, 30 half 15, half 7.5, half 3.75. So it was purely a mathematical calculation, right? Okay. No image was there. See, even if image is not there, we know there are four things. Total population, 50% have hypertension. Half of them get symptoms, half of them seek treatment, half of them get adequate treatment. So within the total population, there are four circles inside. This we have to remember, right? Okay. No, this is, I'm sure that this question was there. This has been confirmed by many students that 30% prevalence, and they asked how many get adequate treatment. Adequate treatment. Right? Okay. Yes, this is true for developing country also, developed country also. 3.75% will get adequate treatment. Innermost circle. Innermost circle. Even if it was not so simple, they will have to mention that 15% get symptoms, 7.5% seek treatment, and 3.75% get adequate treatment. Any one of these three will become the correct answer, will get the correct answer. Okay, there was a question. Which of the graphs should be used to depict the following data? Again, these numbers have been told by students. Numbers may be a bit changed, but look at this. Salt intake, blood pressure. You can see as the salt intake is increasing or decreasing, we want to see whether blood pressure is increasing or decreasing. So this is which diagram I should use. Which diagram I should use. 3.75 with two different options, then 3.75 will be the innermost, adequately treated. Okay, friends, this question, can you confirm? We are looking at salt intake, blood pressure. So we are trying to establish relationship between two quantitative variables. So I'm sure all of you must have marked scatter diagram as the answer. Correlation, yes, relationship between two quantitative variables. So this is fine. Okay, let us move forward. This has been confirmed. Values may be a bit different. 4.1, 3.2, 5.1, because it's not easy for students to remember all these 10 values after the exam correctly. Yes, even if salt intake is in ascending order, that would have been a better way to represent. Blood pressure increasing or decreasing with that relationship is established by. So what I will do, based on your recommendation, I will put this number here, right? Okay, thanks. Then there is a question first to confirm which image of Ayushman Bharat was there. Ayushman Arogya Mandir, which image was there? Was it number one? Was it number two or something else? But students told me that image of Ayushman Arogya Mandir was there. But they were not able to share the exact question. Exact question. Can you tell me what was the question? Question something was what students have told me. Identify the image, mark which of the following change has been there in the National Rural Health Mission. Okay, second image was there. Okay, so I will remove this image. Okay, so let us look at this image. Can you tell me the question? What was asked exactly? What was the question asked? Because students were not able to tell me the question. No name or image was there. No image was there. Image of Ayushman Arogya Mandir was there. They asked the other name. Other name is Health and Wellness Center, as we have discussed in the classes also. Last time also in your exam, there was a question on Ayushman Arogya Mandir does not provide services related to laundry. Other health, diagnosis, treatment related services, essential drugs, everything is available at Ayushman Arogya Mandir. Right? Okay. Yes, this is a sub center. Sub center, health and wellness center. So one of them has to be. Yes, okay. If they ask its new name, the new name of this is now Ayushman Arogya Mandir. So please confirm new name of health and wellness center is Ayushman Arogya Mandir, right? Okay. Okay, Ayushman Arogya Mandir was in the option. Okay, that is good. In fact, that makes the question even more easy for us. So I hope all of you have marked this answer correct. Even if name was hidden, was the name written on the image in Hindi or English that Ayushman Arogya Mandir it is? Was this name written, this one, in the image? New name is Ayushman Arogya Mandir. Earlier it was Health and Wellness Center, Sub Center under Ayushman Bharat program came to be known as Health and Wellness Center. That came to be known as Ayushman Arogya Mandir. No name was there on the photograph. Okay. No name was there on the photograph. Okay. So Ayushman Arogya Mandir. Okay. TPN bag is thrown into which biomedical waste management bag? I think this was also a fairly direct question. TPN bag means we are looking at plastic, which is a contaminated recyclable waste. Can you tell me plastic red colored bag, contaminated recyclable waste, which bag should be used? Yes, it will go into red bag, right? Okay, we move further. There was a question on expired medication. Can you please confirm if this question was there? Because I was surprised to see so many questions from biomedical waste management, but we have discussed in detail. Was there a question on expired medication? Okay, you are saying here TPN bag photo was also there. Okay, that I will add. It's then it becomes even more easy. Plastic photograph, plastic bag. You have seen TPN bag in your hospitals also. Ayushman Bharat program, Ayushman Arogya Mandir is the answer. Okay, incinerator was in the option. If bag is not asked, then yellow bag is subjected to incineration. So you have to confirm, was the bag asked? Was the method of disposal asked? Okay, one option was black. TPN with attached tube. Okay, that I think one student told me also. Attached tubes, that I will add. Expired medication treatment is not through autoclave. Autoclave was in one of the choices. Okay. So it is, yes. So yellow incineration, you just have to confirm. Was the bag asked or the process or both were asked? Bag, process, both. Bag was not asked. Okay, good. So it is incineration. Yellow bag, expired, discarded medicines, incineration should be done. Deep burial was an option. Okay. Deep burial we have discussed in the class is only for placenta after delivery at a primary health center. That was also an old question. Right? Okay. So we go with disposal. Good. Everyone is confirmed. Then there was a question on calculation of Pearl index. Number of accidental pregnancies, total months of exposure into 1200. So you can see 4 upon 3000 into 1200. What is the answer we have marked? Please confirm the choices also. Answer will be 1.6 because other choices students were not able to share. Could you please share the other choices? This will come 1.6 per 100 women years. Okay, thank you, Dr. Vikas. I'll take a screenshot of your question. Thank you. Okay, one choice was 0.8. Okay, this is the answer. irrespective of the choices. One choice was 2. Okay. Answer is 1.6. So I'm sure all of you have calculated this correctly because Pearl Index, we discussed so many questions on calculation of Pearl Index. This is always automatically per 100 women years. Per 100 women years. It automatically comes. Right? Okay. 16 was not there, 4 was not there, 8 was not there. Right? Okay, great. Then formula for maternal mortality rate. You have to confirm. Some students were saying ratio was asked, or was it rate? Because both have been asked in your exam earlier. Can you now confirm, friends, whether maternal mortality rate was asked? Then answer will become B. If maternal mortality rate was asked, or it was maternal
विवेक सर के
mortality
बाद
ratio.
वो है
Uh,
बायो
Mukta ji, there is a disturbance at your end.
होने वाला है, ज्यादा क्वेश्चन नहीं है उनके
Mukta
पास।
ji, there is a disturbance at your end. Team, please.
मैंने तो बना के दिए
Team,
थे।
please. Team, it is. Okay. So, friends, please have a look. Have a look. Okay, question was not there. Net reproduction rate will come separately. This question was not there. Okay, I delete. Okay, students were saying this was one of the questions. Okay, let's move further. Was there a question on contributors to dependency ratio? Please confirm the question. I'll come to that. I'll come to NRR question also. Please confirm if there was a question on dependency ratio. Was there a question on dependency ratio? No. Okay. Remove it. Okay. Life expectancy comparison in two countries. Was there a question related to this? Please confirm if there was a question related to life expectancy only told by students on WhatsApp. Please confirm there was a question on life expectancy or human development index. Please confirm. I'm looking at your chat box on YouTube only. Was there a question related to? Okay, there was a question on ICDS program of India. Please confirm that calorie and protein supplementation to a child 6 to 72 months was asked. Please confirm. ICDS program, calorie and protein supplementation to a child 6 to 72 months. Airborne infection, respiratory infections are same. Dr. Musab Nazar, even instead of respiratory, they wrote airborne infection. Both are same. Both are same. Okay, this question was there. So in ICDS program, it is 500 calories. This is the answer for a child. 600 is for reproductive age group females. This is for malnourished child as per ICDS guideline. Malnourished child. Depending on the choices may be a bit different. This is the answer. In a child, we give up till 6 years of age 500 kilocalories and 12 to 50. Okay. In some choices, we are being told 200, 300 kilocalories were given, 6 to 8 grams protein. No, this is not correct. This was the older guidelines. Now we are giving, since last 11 years now, 500 kilocalories and 12 to 14, right? Okay. Please confirm if there was a question on this immunization session. There are two ANMs, 2 hours time. They have to complete a total of 40 vaccinations. They have one vaccine carrier. What will you do to avoid wastage of vaccine or medicine and do session effectively? Do session effectively. Mark the best strategy. Okay, we go back to previous question. Students are saying ICDS was not there, school was there. See friends, this you have to confirm because question was attempted by you. If it is school, it will become midday meal program. If it is ICDS, answer remains same. Answer remains same. Okay, so we look at this. We come to this. Immunization session, 2 ANMs, 2 hours time. towards time 40 vaccination. So you can see 120 minutes for 40 vaccination. They will get 3 minutes per vaccination. When a lot of children has come to the center, you cannot remove them from the list. No chance of immunization should be missed in the RCS program of India. Adding vaccine carrier will not speed up the process. Right? So what is logical? They divide the work. Documentation is equally important as vaccination. So let one of them work on the documentation, maintaining the records, one of them to work on the vaccination. Work on the vaccination. Okay, it was ICDS. Okay, majority of students mentioned ICDS. Okay, but one student is confirmed it is midday meal. Friends, you have to decide if it is ICDS, which majority of students say, then the answer is correct, right? Okay, let's move further. Please confirm a question came 100 patients telephoned, asked about if they exercise daily and have coronary artery disease now or ever before. Identify the study design. Identify the study design. If this question was there, then the answer is cross-sectional study. Both we are looking at the same time. Slight language difference may be there. Students were saying 100 patients were given, 200 patients were given. No, it's not about vaccine carrier in the previous question, carrying the carriers. It is about managing the session effectively, which was mentioned in the question. So you have to give vaccination, you have to do record maintenance at the same time. Let them do division of labor. This is known as division of labor. Okay. What were the choices? Cross-sectional was given in the choices. That becomes the answer. Friends, please confirm if cross-sectional study was given in the choices. Okay, cohort study, it was mentioned observational, you are saying. One question choice was experimental. Okay, then answer is cross-sectional study. Cross-sectional study. Okay, let's move further then if it was. Then there was a direct question on screening is which level of prevention. Students were saying some specific screening was asked. If you remember that, could you please confirm? Because otherwise, screening is secondary level of prevention. Otherwise, it is secondary level of prevention. Screening is early detection of disease in apparently healthy by means of rapidly applied test. Okay, Dr. Rohit is saying it was midday meal only, not ICDS. Then it will change, friends. In midday meal, it is 450 kilocalories. You have to remember, and 12 gram protein in children below 5th class, and up to 8th, it is 700 kilocalories and 20 grams of protein if it was there. Breast cancer screening. Okay, great. So any screening, majority of them, except maybe prospective, belongs to secondary level of prevention. Okay, 1,000 women screened in a hospital for breast cancer. Okay, that makes it question, right? Okay, besides screening, they are saying in the question, there was also a mention of, students are telling, treatment also. Both belong to secondary level of prevention. Okay, it was a camp. It was not in a hospital. They are saying it was in a camp. So that will also be screening of breast cancer is also secondary. Treatment of breast cancer is also secondary. So 100% of you must have marked this answer correct. Let's move further. There was a question on net reproduction rate, but students were getting confused in the language. See, direct language, if you see, number of girl children produced minus mortality. Otherwise, you can say how many girl children are replacing, how many newborn girl children are replacing one woman dying. Both are same correct answers. You have to tell me which was given. Which was given. Okay, mortality was not there. Was any such language given? And woman who is dying is replaced by how many newborn girl child? If such language was there, that is also net reproduction rate. Okay, replacement was not there. Friends, you will have to help me with the language of the question or the choices then. Dr. Utkarsh, Dr. Aarti, please help me with the language. Inertization, okay, that must be a separate question. We'll see separately. Okay, language no one remembers. Okay, number of daughters an infant baby produce in future. So number of daughters that a girl is going to produce in her future reproductive lifespan, and out of them how many remain alive, that is also net reproduction rate. Same thing is said in different language. Number of daughters produced by a newborn girl child in future reproductive lifespan. So what does it mean? See, it has different ways of saying same thing. If a girl child is born today, in her life, how many girl child she will produce minus the deaths? If a girl is or woman is dying today, she is replaced by how many living girl children? Okay. So answer has to be related to this. What I will do, friends, I'll try to improve the language with the number of help from this total number of girl children born in the reproductive age minus mortality per every girl child. Yes, that will become correct. Okay. Was there a question like this? Please, friends, confirm. Four things I was told were given in the boxes: evaluation, monitoring, planning, implementation. And we were asked to arrange them in sequence. Asked to arrange them in sequence. Evaluation, monitoring, planning, implementation. And we were asked to arrange them in sequence. Please have a look at this, friends. Evaluation, monitoring, planning, implementation. Okay, it was there. It was there. Okay. So can you now confirm whether these four words only were there? Evaluation, monitoring, planning, implementation. A student was, okay, delegation was also there. So implementation may not be there. It may be delegation. Is it right now? Okay, three you have to choose. How? Evaluation, planning, execution, and delegation. Okay. See, whenever you look at a planning cycle analysis of existing health situation, then you have to plan, then you have to execute, and logically evaluation will come in the end. Depending on what else was given, will lie in between. Planning cycle starts with planning, ends with monitoring and evaluation, if it was given. Delegation also will come in between if it was there in the choices. How you delegate the word for implementation or execution, right? Okay. Okay, what does broad planning contains? Question was broad planning. Okay. Okay, great. So if you are looking at three, then these are the three best options in sequence: planning, execution, evaluation. Planning, execution, evaluation. If you are asked about three out of them, right? Was there a question on why health for all has changed to Millennium Development Goal, Sustainable Development Goal? Health for all. Why it has changed to Millennium Development Goal, Sustainable Development Goal? Making a plan will also remain same, Dr. UAKX. It will remain same. Okay, plan, formulation. Yes, first is to make a plan, absolutely. Okay, there was a question on this also. See, health for all was for year 2000. Okay, can you help me with the choices? Because students are not able to tell me choices. So I presume if any of the choice was like this, measurable targets, that will become a better answer. Why? Because health for all was a very broad goal. Everyone should be healthy by 2000. Then we decided, let us make it more specific. MDG by 2015, SDG by 2030. Yes, they were not, health for all was not able to reach their goal. So they broke down into targets easy to achieve. Yes, health for all initially was not time bound. Okay, this was one of the option you were seeing. Later, but it became time bound that we should achieve it by 2000. Targets on time. Okay, target question was there. So measurable was not there. It was for only communicable diseases. That is not correct. It included non-communicable diseases also. Only for low socioeconomic countries. No, that is not correct. That is also not correct, right? So it has to be related to measurable targets or to quantify whether you have achieved them or not. Okay. Was there a question? This I am not sure that this question came because only one student was insisting in a group that you were asked about route of transmission for hepatitis A. So I will delete this question. Was there a question on route of transmission for hepatitis A? Such a easy question may not have been there. Please confirm. It has to be from some other subject if route of transmission was not asked. Not asked, na? Right. Okay. Okay, this we have discussed. Was there a question on pleomorphism in chickenpox, friends? Was there a question on pleomorphism in chickenpox? Please confirm. Was there a question on pleomorphism in chickenpox? Can you confirm? And what was the exact question? Okay, it was there. Okay, it has already been discussed by other faculty. Let's move further. Was there a question on treatment of lepra reaction in multi-drug therapy in the leprosy program? If it has not been discussed by others, then it has to be prednisolone. Okay, students are asking, there was a question on botulism. What was the question? Route of transmission. Canned food was there in the choice. Okay, then that will become the answer. If canned food was there, then for botulism, canned food, yes, becomes the correct answer. It is also through sometimes spores in dust. In the dust, spores are there, or it may also be through a wound. Also, if though there's botulism, Clostridium botulinum manage to infect a wound or enter the wound, then also it can occur.